It's okay to be distracted by traumatic injuries. It's not okay to be fooled by them. Traumatic injuries to the face, to the head, or open injuries to the chest, the abdomen, and to the extremities can certainly be distracting to your assessment. Being distracted by the devastating injury or injury pattern is a natural human response. The paramedic, however, cannot be fooled, no matter how devastating these injuries appear, that they are the only injuries or the most serious injuries the patient has. The point is, no matter what is ripped open, sticking out, or impaled into the patient, the paramedic must fully assess the patient, the mechanism of injuries, and the surroundings. Next is the principle of what lies beneath. Understanding of anatomy in relationship to injuries, injury patterns, and mechanism of injury. This is important. It's not enough to simply observe the injury from the surface. The paramedic must understand the implication of that injury on the tissues, structures, and organs that lie beneath that injury. What appears to be a superficial soft tissue injury on the outside can have substantial structural organ injury beneath. Only by possessing a solid foundational understanding of anatomy will the paramedic be able to relate exterior body damage to where the injury truly is, that is, to the structure, the organ, or the organ system that's impacted by the trauma. Next, check the major areas. No matter what the injury pattern, or mechanism of injury is, always assess the head, the neck, chest, abdomen, pelvis, and long bones. These areas often go unchecked when we focus on a single area of the body. The point here is, no matter where the injury is, all of these areas must be assessed, even if they appear uninjured. A note on the neck. We spend an awful lot of time worrying about C-spine injuries and trauma to the posterior neck, and that's a good thing. But we can't ignore the injuries to the lateral and anterior neck, including the vessels and the airway. Next point, change your view. Way too often we assess patients while they're in a supine position, staring straight down at them. After all, that's how we train you in EMT school to do it. To be effective, change your point of view. Get down on the patient's level and examine from one side. Survey the patient from a short distance. Observe a few breaths while kneeling at the patient's feet or head to get a better perspective on what is actually going on with the patient. Next, assess any trauma patient for hypothermia and assess any hypothermic patient for trauma. Think, trauma equals hypothermia and hypothermia equals trauma. Trauma patients may lose the ability to thermoregulate and have a difficult time keeping warm, especially if there's uncontrolled internal or external hemorrhage. Hypothermic patients may not be able to feel pain of any type of injury and may not have the mental ability to comprehend the injury and report it. In summary, you can be distracted, just don't be fooled. As long as a momentary distraction does not lead you to being fooled by a nasty-looking, less serious injury. Think about what lies beneath. Anatomy lies beneath, and your understanding of anatomy will lead to better treatment and assessment. Next, always assess the critical areas: head, neck, chest, abdomen, pelvis, and long bones, even if they seem uninjured. Change your view. Move around, look at the patient from various views, and from a distance. Get as much of the picture as you can. And finally, trauma and hypothermia. They go hand in hand. Any trauma patient should be assessed for hypothermia, and any hypothermic patient should be assessed for trauma.